after. Yes, it's 4 minutes after 5 or in Israel and 4 for you. My name is Orly Spivak from the Chief Scientist Office of the Israeli Ministry of Health, and I am your host for today. I'm glad you can join us this afternoon on the Vaccine Efficacy webinar, Waning Immunity and Booster Dose Report from Israel. Today we are featuring Yair Goldberg from the Technion, Israel Institute of Technology, Haifa, and Amit Huppert from the Gertner Institute for Epidemiology and Health Policy Research of the Sheba Medical Center, Israel. Yair Goldberg and Amit Huppert will present their results from clinical trials in Israel on vaccine efficacy, waning immunity, and the booster vaccination. Worldwide shortage of vaccination against COVID-19 infection while the pandemic is still uncontrolled led many states to the dilemma whether or not to vaccinate previously infected persons. After a period with almost no COVID-19 infection, a resurgent COVID-19 outbreak started in Israel mid-June 2021. Possible reasons for the breakthrough were reduced vaccine effectiveness against the Delta variant and waning immunity. Data are also needed regarding the effect of the booster dose on the rate of confirmed COVID-19 cases and the rate of severe illness. The team from Israel analyzed these questions in different studies and will present their results and their conclusions in this webinar. The webinar is being recorded. At the end, we will have some time for questions, but of course, feel free to write your questions in the chat anytime. And now I give the stage to our experts, Yair and Amit. Shalom.
Hi. So I'm going to do the first part of the talk, and then Yair will do the more difficult part of explaining you the analysis. So as you can see here, we've been collaborating, not only Yair and I, people also from the Hebrew U and the Weizmann Institute and the Ministry of Health. At the end, you'll see the other participants. We're a group that started to work together around March 2020, and our idea was to give support to the Israeli Ministry of Health in making decisions regarding questions about COVID-19. We're not going to talk about a clinical trial, because this is not a clinical trial, it's an observational study. And we'll take you through. Feel free to ask us questions and we'll try and answer during the talk. Each time the other one doesn't speak, he'll try and answer the questions in the Q&A. And at the end, we'll be happy to take questions and answer them as well. So I am Amit. I'm a mathematician by training, and Yair is a statistician. I'm from Gertner, Yair is from the Technion, and we have no competing financial interest to disclose. We were asked to show you this slide, that the COVID-19 VACCELERATE webinar, COVID-19 during 2021 in Israel, waning immunity and booster dose effect, Cologne, Germany, has been accredited by the European Acceleration Council for continuing medical education with 1 European CME credit. Each medical specialist should claim only those hours of credit that he/she actually spent in educational activities. So I hope nobody watches this because they will think this is not education. I'm just kidding. Okay, so the outline of our talk. So we're going to show you a little bit the history of the outbreak in Israel since December 220 to April 221. And we'll talk about the Delta resurgent in Israel during June 2021 until now. We'll talk about the waning immunity and the booster campaign and how it helped to curtail the outbreak. Okay, so my first slide is just the time series of new confirmed COVID-19 cases per million in Israel. And you could see that the outbreak in Israel started somewhere here in around March 2020. And we had a first outbreak that now looks like almost noise in the time series. It reached, you see, around 70 cases per million. Israel is about a country of 9 million. And then there was somewhere around April, there was a lockdown, and you see the lockdown was able to curtail the outbreak. The outbreak went down, and then the economy was opened. We started having a climb, and then school opened in September last year. We had what we call the second wave, was a very big wave. And then there was a lockdown somewhere here. It went down. And then again, the economy was open. We started seeing the climb, and somewhere here at the 20th of December, vaccines arrived. Okay, and if we follow the next slide, we can see that the vaccination in Israel. So almost everybody in Israel was vaccinated with the Pfizer BNT162b2 vaccine with a 3-week regime, which means you got a shot, then a second dose 3 weeks after your first dose. And the vaccination started in the 60+ age group and in healthcare workers. So you see it started at the end of December, 20th of December. So you see the green line went up first and reached about 90% of the eligible population got vaccinated. Then it was gradually opened, then 50 and up, and then 40 and up. And here we plot the 40 to 68 group, which you see started later. And also the vaccine uptake was lower, it's around 82%. And then the third group, which was the youngest group, opened later, and it reached about 70-something%. And then around, I think, May, we opened it to kids 12 to 17. And next week, we're starting to vaccinate 5 to 12. And let's concentrate on this third wave. So here, as I told you, there was a start, the cases started to rise. The x-axis are the dates, and the y-axis is reported laboratory confirmed cases, so PCR positives. And on the 20th here, the vaccination campaign started. And then you see a week later, there was a lockdown, but the compliance to this lockdown was not so great. And it started, it continued going up. There was a tighter lockdown. And somewhere here you see both the lockdown and vaccination started affecting the transmission dynamic. And you see it started to, the outbreak started to go down. And there was a first phase of reopening February 7th, second phase, which meant even less regulations, February 21st. And after March 7, so the only restrictions, I think, were masks, wearing indoors, which would also later relax. So it seems that the vaccination campaign worked really, really well in order to curtail the third wave. And then we kind of thought that we'll have a very long, quiet period without an outbreak. And the interesting thing, if you look, this is again dates, this is vaccine coverage. So you can see Israel reached relatively high vaccine coverage, that over 60% of the eligible population. We're a young country, so we have about cohorts about 200,000 kids. So if you take the 28 cohorts of kids, you have something like a little bit less than 4 million kids out of a 9.4 million population, and about half of them were not until recently eligible for vaccination. So you had about 8 million people eligible for vaccination out of the 9 of the population. The second important point that I want you to notice that look that Israel reached these high vaccine levels much earlier than other countries. You can see the UK, US, Germany, and Italy, and France as references. And if we look at this more closer, so Israel around March already achieved very high vaccine coverage. If you compare Chile's about Chile, US, and UK about 3.5 months after us, then continental Europe, these countries are about 4 months after Israel. So what we're going to show you, this waning immunity that we kind of noticed around June is expected to be starting to be more and more dominant now in Europe. And this is an important factor to take in mind. Okay, another important factor that we have a very large testing capacity. So it's about 16,000 tests per million per day. And we have a comprehensive electronic COVID database that Yair will describe in a few minutes. So we're going now to explain the Delta outbreak. So if I show you the graph up to here, that was the third wave. We saw it was a very, very strong and fast decline in Israel, and somewhere around April, you see we had really few cases. That here in the minimum, which is May to June, we had about 20 cases per day, which half of them were Israelis traveling, coming back to Israel from other countries. So there was very, very little transmission. But suddenly in mid-June and beginning of July, we started seeing this really rapid exponential increase in reported cases, which kind of took us in surprise. We didn't expect such fast growth so soon after the vaccination campaign. And if you look at our reproductive number, so you see from end of June till almost August, we had a R of about 1.32, which implies about a doubling time of every 2 weeks. So we had this really fast growth. And here you could see again the PCR positive. So you could see this exponential growth. And so our cases rose by more than 100-fold in 1.5 months. So we had a really fast growth, as you saw also in the previous graph. And even more worrying and surprisingly, that our severe cases in the hospitals also rose exponentially. And our severe case is used NIH definition, which is a resting respiratory rate of 30 breaths per minute, or oxygen saturation lower than 94%, and some other oxygen pressure measure. And during this rise that I've talked about 60% of severe cases were people who received 2 vaccine doses more than 2 weeks after vaccination. So it seemed that the vaccine is not protecting as well as it should. And just one more important element in the puzzle is that until June, the main strain of COVID in Israel was Alpha. And then, but you see somewhere around May, Delta started to be the dominant strain. And the time we're talking about, which is the June outbreak, you see we were over 95% Delta. So kind of we had the question, what is the cause for this outbreak? Is it vaccine breakthrough because of it's a new variant, the Delta, or is it waning immunity, or is it a combination of factors? So this was our situation, and I'll let Yair show you how we analyze the data. So, Yair.
Amit, can you see the share screen? Amit, can you see my screen? I can't hear you. So,
Yes.
okay, good. Sorry.
Do you want me to stop sharing and you'll share, or you want?
No, if you can see my screen, it's good. Just a second. Sorry. And okay, so now you can see my screen. Okay, so as Amit said, what we wanted to answer is the question if what we see is waning immunity or is it the Delta, and what can be done in that case. And we were worried because so many people who are doubly vaccinated came to the hospitals with severe cases, and the numbers rise so fast that it was clear that the hospital won't have the capacity to deal with that. So we tried to use the data to answer the question, what's going on here? And the data in Israel is really, really good. What we have, first of all, Israel has centralized electronic medical record system. And the Ministry of Health collects data routinely from all HMOs. We have 4 HMOs in Israel and from all hospitals. And the data is linked using the person identity number, which means the data that comes from different entities still can be linked, and we can use it and identify the individual. Also, all residents belong to an HMO. So, and we have, that means that we have for everyone in Israel, here it's written over age 16, because this study is about age 16 and above, but in general, we have the following data for everyone in Israel, which is where they live and the age and all the PCR tests. And some people have like 100 tests, but still have all the data and the results, and also infection dates, if they have 1 or 2 or even more. Now we have even some people with 3 infections, and the severity, and also vaccination date, 1st, 2nd, and even 3rd. So using this data, we wanted to answer the question of do we observe waning immunity that causes the severe cases and the infection and the breakthrough, or is it Delta? And as you'll see, it's a little bit complicated question, and we have some answer to it. And let's start with this slide. This slide is a little bit complicated, so let me start with the following. First of all, we are looking at July, from July 11 to July 31st. This is 3 weeks in the beginning of the breakthrough, the Delta breakthrough. And we are looking on different age groups. So let's start with age 60 and above, and later on we'll discuss the other ages. So what we wanted to know is, do we see waning immunity? Waning immunity means that if you were vaccinated first, you are going to have less protection. So this bar is for people who were doubly vaccinated during the second month of January. And this bar is for people who were doubly vaccinated during the first half month of February. And this is for second half of February, etc., etc. I mean, March, first part of March, second part of March, April and May. So these people were vaccinated 2 months before the study, and these people were vaccinated 7 or 6 months before the study. And what we see here is the height of the bar represent the rate of infection. So it's 3 weeks. We had about 3 people out of 1,000 people got infected if they were vaccinated early, compared to only 1.5 people if they were vaccinated late. So the newer the vaccination, the better the protection, or the older the vaccination, we observe waning. And this is crude data. We just plotted the data as we saw it. And this is for age 60 and above. If we look at ages 40 to 60, we see roughly the same picture. We see the same kind of pictures that if you were vaccinated early, you have many more, the infection rate is much higher. These bars are in white because in Israel, as Amit said, the vaccination campaign gradually moved from elderly to younger ages and then to people who are even younger. And the first people to get vaccinated here in the white bars are either healthcare workers or people at risk, but also because if you remember the BNT vaccine, you couldn't keep it for a long time. So many people just come at the end of the day and got vaccinated. So this is a mix of people who are just regular and people with higher risk. And we see again the same picture. This is really like a picture of waning. We see that the older the vaccination, the higher the rate of infection. And again, same for 16 to 40. And this is not only for infection, the same exact picture we see also for severe cases. And this is, we believe, the reason that we saw so many people who are doubly vaccinated at the hospital. If they were vaccinated in January, they have higher rates of severe cases than people that were vaccinated later on April and May. This is for age 60 and above. And we see again, if we look at younger ages, when the rates are much lower, we see again the same picture. If you were vaccinated before, you have your protection is not as good, and you have more chances to get severe case. So that's the picture we got. When we try, so as I said before, this all is just the crude data. We just plotted the data as is. What we tried later on is to correct for many confounders, because in Israel, not all the population got vaccinated at the first stage. It depends on socioeconomic status and on demographic groups, etc., etc. So what we did is we used a regression, Poisson regression. It's a kind of statistical model for adjusting for the different confounders, as you can see here. And all the graphs are, all the tables, all the numbers look the same, but let's look at the age 60 and above. So what we see here is vaccine efficacy. And I don't know if you remember, but in February, March, in Israel, we believe that the vaccine efficacy is about 95%, which is really, really high. And what we observe during the Delta wave is much, much lower. So we observe about, for people who got vaccinated very early, and they were doubly vaccinated during the second part of January, we see only 57% vaccine efficacy. And if you were vaccinated later on, your vaccine efficacy goes up. And if you were vaccinated during May, your vaccine efficacy is 75%, which is better than 57, but not as good as 95. This means that what we see is probably a mixture of both Delta, which is a breakthrough in the, of the vaccine in one part, but also waning of the immunity, which we can, I think, see clearly from this table. And if we look at the severe cases, we also see that there is waning. People who got doubly vaccinated during January have 86% vaccine efficacy compared to 91% vaccine efficacy for people who got vaccinated in March, and the number in April were too low to present. And you may think that 91, 86, that's not a big difference, but if we compare it to what we observed in April before the Delta, and when the vaccination was still fresh, what we observed was in April, people who vaccinated in January to March have very high protection, 97% vaccine efficacy, compared to what we observe now, about 85, 86% vaccine efficacy. So if we look at it in a more, I think, clear way, we can look and see here we have 97, which means 3% relative risk. And if we compare it to what we observed during July, which is 85% vaccine efficacy, which means 15% relative risk. So what we say here is that this is 3 compared to 100 people who are unvaccinated, but now we have 15 compared to the 100 people who are unvaccinated. So we have 5-fold increase in relative risk. So although it looks good, 85% vaccine efficacy, in practice, that's not that good protection, especially against the Delta. And this is one of the reasons we saw such breakthrough in severe cases that made the hospitals almost full in Israel. And based on the evidence of waning in Israel and the trajectory toward exceeding national hospitalization capacity, given the rapid rise in severe cases, Israel decided to begin a 3rd vaccination campaign, the booster campaign, on July 30th, starting with the elderly. And what I'm going to show you now is the results of this campaign. So as I said, the campaign started with the people who are age 60 and above. And I have to say, when Israel started with the booster campaign, it was not clear that it's going to help. As I said, it was clear that the Delta is part of the problem, and it wasn't clear that the booster will help against the Delta. And some suggestions were to wait and see that Pfizer will produce a better vaccine that can help against the Delta. But Israel decided to go for the booster because it was understood that waning is part of the problem. And the first people to get the booster were people who are age 60 and above, because are in higher risk to get severe cases. And after 2 weeks, Israel estimated that the booster does help, and decided to vaccine to allow people who are age 50 to 60 to get the vaccine. And later on, gradually, other age groups were also eligible for the booster vaccine. And overall, now I think we are about 5 million people with the vaccine, but when for this slide, we see only in October, only 3.7 million. Okay, so our analysis is about all the people who got at least 2 doses. And we wanted to see the effect of the booster for those who got the booster compared to those who had 2 doses, and not compared to the unvaccinated. Unvaccinated in Israel is a small group, especially in older ages, and are not representing the population. So what we try to do is to compare all the populations that got vaccinated at least twice, and compare people who got 3 doses to people who got 2 doses, and see if the booster was actually helpful. And as written here, we have a lot of people here in the study, more than 4 million, and a lot of confirmed infections, more than 100K confirmed infection, and severe illness, and even death during the study period, which is August to September. So what do we expect to see after the booster dose? So in Israel, as I said, the elderly people were vaccinated first. And for example, my parents got vaccinated. They have 15 grandchildren. And the day after the day of the vaccination and a week later, they told my siblings that for 1 week, they can forget from babysitting. They are going to stay at home. So people, after they are getting the vaccine, tend to stay at home, not going to PCR tests because they think maybe we have just side effects. And what we are going to see is protections that related to behavior and not really to the effect of the booster. And this graph, what means that the higher we see, the higher the line is the higher protection. This is fold reduction in risk compared to 2 doses, so higher is better. So in the beginning, there is some protection, which is not really just because people stay at home. And then it's going down, but then we expect the booster to affect and going to see a protection or reduction in rate or in risk that related to the effect of the booster. And that's exactly what we saw. And this is results of Poisson regression, again, correcting, adjusting for confounders like age and gender, etc. And what we try to see, each bar represent 1 day. So this is day 0, the day you got your booster vaccination, and you are 5 times more protected compared to people who didn't get the booster. And this is mostly because people, on the days that they get a vaccine, they usually don't go to take a PCR test. And later on, we see that this protection, this transient behavioral protection goes down, and the booster kicks in and the protections goes up. So what we see here, for example, this bar at day 16 is about 10, say, fold reduction in infection rate. So people at day 16 from booster are, the risks of getting infected is 1/10 compared to people who didn't get the booster. And we can see that even after 2 months, the protection is good. We continue this, as I said, this is going until the beginning of October. We're now in mid-November, and we still follow the booster to see if we see waning. And to be honest, it's still too early to see waning now. We don't really see such result. It's still not clear, but it's only the beginning. We're 3 months after the booster, and it's still, the protection is very good. So again, this is for age 60 and above. Here is a little bit more data. So there are 12,000 people who got infected in the non-booster, only 2 doses, and 2,600 that got the booster. And after 12 days, we have only 2,600 cases. We have a lot of risk days. So it's a big study. We follow, it's not like a clinical trial. We have here, as I said, more than 4 million people in this observational study. And the protection we observed after day 12 is about 12 times protection, or 12-fold reduction in infection rate compared to those who had only 2 doses, didn't get the booster. Here, the same result for other age groups. As you can see, we have longer follow-up for people who are age 60 and above, and people who are 16 to 29, we have the less time follow-up because they were vaccinated later. But we do see similar pattern. Beginning, there is something, which is the protection that is related to behavior, and then it's going down, and then the booster get effect, and we see roughly steady protection of about 10 folds increased protection. This is the same table as before. I won't go into the details, but we see that over all ages, the protection is good. It's a little bit less for people who are 30 to 40. We don't know exactly why. And it's much higher for people who are 16 to 29, probably due to 29, probably due to the difference in who is getting the vaccine at that age. And younger ages, less people got vaccinated, got the booster. It's an important study, and it was important to check very carefully to see that these results are actually correct. And when you do observational study, unlike doing a clinical trial, you have a lot of confounders and a lot of things that can make the analysis more complicated. And what we did is we tried different techniques to do the analysis in order to get more confident in our analysis. And one of the things we did is to try a totally different analysis technique. So the technique, what I showed you before, is based on what's called Poisson Regression. It's a statistical model. And we also tried other methods. And one of them is called matching. This is similar to vaccine efficacy studies from Israel run by Dagan et al. And with Miguel Hernan and Lifshitz and other big experts in the field. And the idea of matching is the following. So we want to try to take 2 people that are as much similar as we can. One of them got the booster and one didn't get the booster, but they are similar in all other aspects. So they are the same age group, the same city, the same sex, the same sector, demographic sector, etc., etc. And we follow them. We follow them from the time that one of them got the booster and the second didn't get the booster. And we follow until 12 days. And then we try to see if one of them get infected. If one of them got infected, we check which one, if it's the one that got the booster or the one who didn't get the booster. And at the end of the study, some people, I mean, most of the pairs didn't get the booster, didn't get infection anyway. Some of the pairs, for example, this one didn't get the booster, but after 5 days, this one got the booster. So also this pair is dropped out of the study. But at the end of the study, we have some pairs that the booster guy got infected and some pairs that the unbooster guy got infected. And we just compare the number of such pairs. And what we see is that we have 10 times more pairs with not booster for age 60 and above, and same for 50. And roughly speaking, we got almost the same result using totally different statistical technique. We also tried another sensitivity analysis. What we try to see is to compare people who got the booster to themselves, to the same. So to have like as much similar population, those who got the booster to those who got the booster, and not to people who didn't get the booster, who maybe have different characteristics. In Israel, especially for age 60 and above, this is not really relevant because 95% of the population who had 2 doses got also the booster. But anyway, we did that just to make sure. And what we see here, this group is already a little bit more protected, and it can show that they didn't have a lot of PCR tests. But even though that this is supposedly more protected than those who didn't get the booster, we still see good protection in this alternative control group. Not as good, not 10 times or 12 times, but 7 and 5 or 6 and even 11. So using 3 different techniques to check if the booster is really helpful and what is the levels of protection you gain by the booster, you can see that you gain about 10-fold increased protection compared to people who didn't get the booster. So far I talked only on infection rates. Now we are comparing also severe disease, and here for severe disease, the increase in protection is even higher. So we see 20-fold reduction in rates of severe cases for people who got the booster compared to people who didn't get the booster. So this is so dramatic that really changes the dynamic of the pandemic in Israel. And when we check that also for death, we also saw a reduction of about 15 times reduction for rate for death compared to people who didn't get the booster. So this is really real success of the booster in Israel. And just to return to the slide about vaccine efficacy, so if we saw that vaccine efficacy went down to about 50% at the July, and even lower now in Israel for people who didn't get the booster, 10-fold protection, increase in protection, gets you back to 95, which is roughly the place that we have been during April. And if we observe 80%, if the vaccine efficacy after waning is 80% for severe diseases, and we see increase of 10-fold, and we actually see more, we see about 20-fold increase. So the vaccine efficacy become 97, which also take us back to where we have been on April. Okay, so far this is the study, and now I'm just going to show you what happened in Israel after the booster. So we compare here people who are below age 60, and this is the scale. And people who are above age 60, this is the scale, different scales because this is much smaller group. And as you can see here, until the booster, these lines were the same. This is number of or rate of in daily cases, and it's going down drastically for above age 60, 10-15 days after the booster, after the beginning of the booster. So remember, people, it takes some time until people get vaccinated, get the booster, and still so fast we saw the decline in the new daily cases in Israel. Also, just after the booster, so in Israel it was what's called the high holidays. This is really the biggest holidays in Israel, and about 3 weeks people don't do much, but I would say party. And so the numbers are more complicated to understand. So we also look at the percentage of positive tests, which is also a source for understanding the dynamic in the pandemic. And what we saw in the beginning was about 2% of the PCR tests were positive. And later on, during July and August, it went up until some peak. And after most of the age groups got vaccinated, we see the percentage going down very fast to less than it was in the beginning. And as Amit showed you in the beginning, we had R of 1.3, which is doubling every 10 days, which is really the highest rate in Israel. And without doing any lockdown, like in the 3 first waves, this is the 4th wave in Israel, with no lockdown at all, and without any restriction on the economy, this is the result of the booster. And as you can see, as more and more groups got the booster, the reproducing number goes down to 0.7. And I think, unfortunately, today we see the first time it's going towards 1. I think that today is, but for this, as you can see, starting around September, for more than 2 months in Israel, we have R less than 1. And this is with the Delta, which is very infectious. Okay, I'll stop here. I'll just summarize. What we saw is that there is waning immunity of the BNT Pfizer vaccine. Booster dose show about 10-fold improved protection against confirmed infection and even more for severe COVID. And the administration of the booster dose helped Israel dampen severe cases in the 4th wave and actually succeeded to dampen the whole wave without going into a lockdown. Just thank our collaborators in this project. Our team is Inon from Weizmann Institute, Professor Micha Mandel, also statistician from Hebrew U, Omri from the Israeli Ministry of Health, Sharon, who is the head of public health in Israel, Professor Ron Milo from the Weizmann Institute, and Lawrence from the Gertner, who is really chief statistician. Okay, so thank you all for listening.
Thank you very much, Yair, and thank you to Amit. And now we have a few questions in the chat, and we have the time for them. So we'll start with the first questions. So Michael Schramm, what would be your idea why actually more vaccinated patients were among the severe cases than unvaccinated patients? And I think he refers to Amit's presentation.
So we had much more people who were vaccinated than unvaccinated. So as we showed you, about 80% of the eligible population, and let's say in the higher risk groups, it was around 80-90%. So that's why we had more double vaccinated. And after the booster, you saw these guys did not, or hardly got to being hospitalized. So the waning immunity, as Yair showed you, went down from around 95% to around 80-85% protection, which is a 3-4-fold increase in the risk. And that's why we had so many cases. And that's why it's so, even that it doesn't look such a big difference between 95 and 85 or 80% protection. But as Yair showed you, it's huge. It's a 4-time difference. And that's why we saw so many cases. Hey, you want to add anything?
No, that's good.
Okay.
Or any other questions?
Yes, there are a few. So Anne-Marie Lang asked if we have, if you had data on COVID-19 hospital admissions, a number of patients in intensive care units, and I can answer that you had.
We do have, we actually have even the numbers here, I think, but so hospitalization, I just have to say that it's more complicated because people who get, for example, to give it to the liver, if they are have COVID, they are registered as also as COVID. So we are looking more at severe cases, and the number of severe cases. I mean, we had a lot, more than 1,000 cases during the study period. I don't know if it answers the question, or Amit, anything else to add to that?
So we look at severe, which I gave the definition, which is the NIH definition. I think the ministry has some data on intensive care or not, but we don't have that resolution. So we just look at severe cases, not intensive care.
Yeah. So here, oh, sorry, not this one. We have the number for severe. So here we can see the number of severe. Here we are for the age of 60 and above. This is the number of severe cases we observed, 150 compared to 1,000 cases for the age 60 without the booster. But most of the people moved from the non-booster to the booster. And so we see here many more at-risk days. So I hope that answers.
Thank you. Another question from Pontus Knockler. Were you able to adjust for underlying diseases since individuals with comorbidities might have been more prone to vaccination early?
So that's a very good question, but I didn't show here the numbers, but in Israel, most of the population got vaccinated very early, and people age 60 and above were eligible for vaccination, and most of them got vaccinated within a month and a half. So I don't think that's a big issue. We don't have the data on comorbidities, unfortunately, although it's just, although we have very good data, this is goes from a different registry, which we are not able to link to our data.
Oh, I would just add that the Correlate healthcare service, which is the in Israel, which is about half of the population, and they have this data. And when they did a match study that was published in the Lancet a few weeks ago, they got almost similar results.
Sure.
Which kind of made us happy because we were worried about this point as well.
True. That's
Thank you. Another question from Birch Aidin, I hope I pronounced your name correctly. Was matching done retrospectively or prospectively?
So I've answered, it was retrospective.
Yes, but only the panelists could see your,
okay.
your answer. So it was retrospectively. Okay. Katya asked, it would be very interesting to visualize this data with positive test incidence instead of fall decrease for public health purposes, but I think you have showed the correlation with the positive tests, right?
I just want to say that this is there is a problem when the increase in rates is 10 or 20. And if you look instead of vaccine efficacy, for example, it's very hard to see the difference, because the difference between 97 and 95 doesn't seem like a big difference, but it can be, as we saw, that the difference between 80 and 95 or is five-fold the difference. So we prefer that way of presentation, but we try to do both.
Okay, and then I had a question. If you included people that were doubly vaccinated but were infected or previously infected and then got one vaccine, because in Israel, in the beginning of the vaccination, previously infected people weren't allowed to receive the vaccine.
True. So in Israel, the policy in the beginning was not to vaccinate people who were infected previously. And when there were enough vaccinations, the policy was changed that after 3 months after infection, you can go and it's actually the recommendation was to vaccinate with one dose people who already were infected. We have data on that. We didn't show that here. And what we observed in our data is that people that previously infected have good protection, but this protection is getting even much better if they take one dose after that. Or similarly, if they were firstly vaccinated and then infected, they also have a good protection later on.
Okay, thank you. Next, Maggie asks, any idea about duration of the protection of the booster?
That's a very good question. We really follow it every day. That's something we do all the time, because we try to monitor it, because we are afraid of a next wave if the booster protection of the booster will go down. So far, 3 months after the beginning of the booster campaign, we don't see a real decrease in protection. The protection looks good, but it's a little bit too early to understand the waning, because also we observed roughly same result before for the second dose. I just want to say that other measures like antibody levels seems to be higher after the third dose compared to the second dose, which also may imply that we are going to see a longer time before the decline in the protection. But we don't know that yet. It's just too early for that.
Thank you.
I would add, antibodies is only one part of the immune protection. That's, let's call it the easy part, the thing that's easy to measure. The effective memory and why the 2 doses were not sufficient to block the outbreak, that's the big unknown. And the big question is this booster gonna improve the memory and the kinetics of the memory? That's the real question. And we're gonna have to wait and see. Unfortunately, I don't think we'll know until enough time passes, and we'll see if there's resurgent in cases or it stays low. Hopefully, no more waves, but we can't say that.
So just too early.
Okay. Thank you. Next question by Jesus. First, he wants to congratulate you on your data. He asks, can you give us an idea about waning immunity in terms of infections longer than 4 weeks?
I'm not sure I understand the question, but what we observe, I mean, in the data for the booster, we have now 3 months of follow-up, if that's the question, and we still see good protection. In the beginning, in the papers that we published, we only followed for 1 month, but it was important for us to get the results out so people will be able to use it in other policymakers will know the results. But now after 3 months, we still see a good protection.
Thank you. I think this answers. Michael has another question. Does waning immunity in terms of infections correlate with waning antibody titers? For example, can you use antibody titers as indicators or even forecast of waning immunity?
So, Amit, that's for you.
Yeah, so I hinted a little bit that I don't believe that. Some people in the last week have hinted that they see some correlation between antibodies and protection, because antibodies will wane. That's what they do, right? It's a protein in your blood that has half-lifetime or whatever, and they'll go down. So, I mean, of course, if you have high level of antibodies, you might be protected, but in the long run, your antibody levels are going to go down. So the bigger question is your immune response memory. So the B and T cells will be able to produce enough antibodies given reinfection. So to me, that's the more important question. And we try to correlate the antibody level. We didn't have it on an individual level, on a population level, but there is a paper that was done in Sheba Medical Center showing the waning in antibody levels during this parallel time that we saw this increase in outbreaks. And we couldn't find a clear level that does it. Again, I think that only, even if you do find it, that only part will be a part of the story. So.
Okay, thank you. Another question from Martina. Do you have data on immune correlates of failure of protection on an individual basis?
I answer that. Also.
Yeah, okay.
No.
And Pierre, can we conclude that the third dose has a clear impact on transmission and contagiousness?
So I think that indirect evidence that Yair showed that definitely the transmission could be curtailed using the booster. So I think if you look at the ecological data that Yair showed you, that it definitely breaks transmission. And then there is the big debate. Should you give boosters to people who are not the risk group? So let's say people who have comorbidities or are over 60. And I think that the Israel experience that we've showed you here is, to me, it's a definitely yes. So if we would have only vaccinated the 60 plus, then we would probably see much more infections and also more severe cases.
Okay, so thank you for your answers. I think that's about it for questions. And I think we can conclude. I think it was fascinating. It was a pleasure hearing you and seeing your research. And I would like to thank all of the participants for being with us and for your questions. And that's it, I think. Have a nice evening. And thank you again, Yair and Amit.
Thank you, Oli, for organizing it.
And thank you all for listening to us.